Hello, everybody. In this session, uh, we talk about the importance of studying PBS or peripheral blood smear. As you know, we can use PBS under microscope for investigation anemias, IDA, megaloblastic anemia, etc. Leukemic involvement, for example, acute leukemia especially, and sometimes chronic leukemias. Many infectious diseases, such as malaria or some parasites, live in circulation. Platelet abnormalities in number and shape, and especially in following up of the patient under treatment, for example, for anemia, for leukemia, and etc. In the right side, you see that the red blood cells regarding to the predisposing disease, for example, here iron deficiency anemia, or here megaloblastic anemia, the shape and the size of the red blood cells are completely different from normal situations. Or schistocytes or fragmented cells, he or she tolerated from an acute hemolysis, or sickle cell or target cells that denotes to variable hemoglobinopathies. During leukemic involvement, for example, acute myeloblastic leukemia, acute lymphoblastic leukemia, blast cells are found in tremendous number in peripheral blood, and it is the first step for diagnosing leukemic involvement. You know that it should be confirmed then by bone marrow aspiration or bone marrow biopsy. It's an interesting view. This is the role of formations, and that the red blood cells are attached to each other in a special shape. It is what we see mostly during multiple myeloma and other malignancy, hematologic malignancies. In infectious diseases, for example, in malaria, as you see here, the rings forms of malaria, or in some viral induced diseases such as mononucleosis, you see the lymphocytes are changed, or toxic granulation during bacterial and severe infections are easily found in PBS. Platelet changes, I mean the number of platelets, for example in ITP, or increased in, such as in essential thrombocythemia. All of them can be studied by using PBS. An interesting thing, which is highly related to experience of pathologists or rheumatologists who work in a lab, is that be careful that if the findings of the autoanalyzer is not compatible with the clinical symptoms of the patient, in these situations it must be compare these results with the findings of the PBS. For example, if regarding to a technical error platelets aggregation has occurred, then you will find that this low platelet number is corrected if you studied it by a slide. So during treatment and following up, for example, if you have good reticulocyte number in PBS, it means that the bone marrow works well. Or when the blasts are reduced in PBS, it means that the treatment of leukemic patients goes well, and any finding in PBS can help the clinician and the patient to ensure that the process of treatment goes well. Thank you for this section. In the next session, I will talk to you about the steps of preparing and staining of peripheral blood smears.